What if I told you that your brain can create its own reality? Vivid enough to see, hear, or feel things that don't exist? These are hallucinations, the mind's most powerful illusion, and they can happen to anyone under the right conditions. Welcome back to the Psycho Nurse, where we explore the human mind one condition at a time. Today, we'll uncover the science of hallucinations and why sometimes your brain can't tell the difference between what is real and what is imagined. So, what exactly is a hallucination? It's a false sensory perception that occurs without any external stimulus. That means the person sees, hears, feels, or smells something that isn't actually there, yet to them it feels 100% real. There are several different types. Visual hallucinations involve seeing people, lights, or shapes. Auditory hallucinations are about hearing voices or sounds. Tactile hallucinations mean feeling things on or under the skin. And olfactory or gustatory hallucinations are when you smell or taste something that isn't there. These experiences can occur in conditions like schizophrenia, Parkinson's disease, dementia, and epilepsy, or even result from sleep deprivation and drug use. It's also important to separate hallucinations from illusions and delusions. An illusion is when your brain misinterprets a real stimulus, like seeing a shadow and thinking it's a person. A hallucination, however, happens without any real input at all. A delusion, on the other hand, is a false belief, like thinking someone's following you when they aren't. These distinctions are critical in psychiatry because they help clinicians identify the root cause, whether it's neurological, psychological, or drug-induced. So what happens in the brain during a hallucination? Well, the brain's perception system works like a prediction engine. It constantly guesses what is happening in the world and then fills in the details based on sensory input. But in a hallucination, this system goes wrong. When neurotransmitter levels like dopamine and serotonin spike or misfire, especially in the visual cortex or temporal lobes, the brain starts to generate sensory experiences internally. For example, people with schizophrenia often have overactive dopamine pathways in areas responsible for attention and perception. That excess dopamine blurs the line between internal thought and external reality. Dopamine is the key neurotransmitter linked to hallucinations. Too much dopamine can cause the brain to assign too much meaning to random stimuli. A simple sound could feel like a message. A flash of light could seem like a sign. Serotonin, especially when affected by drugs like LSD or psilocybin, alters how the brain filters sensory input. That's why hallucinogenic substances can produce such vivid visual and auditory experiences. They disrupt serotonin signaling in the cortex. Hallucinations can result from many factors. Mental illnesses like schizophrenia, bipolar disorder, and psychotic depression are common causes. Neurological diseases such as Parkinson's, Alzheimer's, and epilepsy can also trigger them. Drugs or withdrawal from substances like LSD, amphetamines, and alcohol are well-known culprits. Even simple things like sleep deprivation can cause the brain to start dreaming while you're still awake. Sensory deprivation, like in isolation tanks or extreme darkness, can also lead to hallucinations. In fact, extreme stress or trauma can cause short-term hallucinations even in healthy people, showing just how delicate the balance of the mind truly is. I remember a case where a patient described hearing their name whispered while completely alone. Brain scans revealed hyperactivity in their auditory cortex, the part of the brain that processes sound as if someone was actually speaking. The brain wasn't lying. It was simply creating the sound from within. This is what makes hallucinations so powerful. They feel undeniably real even when logic says they can't be. And believe it or not, mild hallucinations can happen to anyone. Ever felt your phone vibrate in your pocket when it didn't? Or seen movement in the corner of your eye that wasn't there? Or maybe heard your name called in an empty room? These are micro-hallucinations, often triggered by stress, fatigue, or hyperfocus. It's your brain's way of filling in sensory gaps when it is tired or overloaded. So how are hallucinations treated and managed? The approach really depends on the cause. Antipsychotic medications can help by reducing dopamine overactivity. Cognitive therapy helps patients learn to challenge their distorted perceptions and cope with the experiences. Simple lifestyle management, like getting enough sleep, staying hydrated, and controlling stress, can significantly reduce their recurrence. In cases like Parkinson's or dementia, medications are carefully adjusted to balance neurotransmitters without making other symptoms worse. Looking to the future, neuroscientists are now using advanced brain imaging and AI to detect the early stages of hallucinations. They are trying to identify the exact moment when the brain's sensory prediction system begins to fail. The goal isn't just to treat hallucinations, but to understand how perception itself works. Because, in many ways, we all live inside the version of reality our brain creates. Hallucinations remind us that the brain doesn't just show us reality, it creates it. Every sight, sound, and touch you experience passes through the filter of your mind. And when that filter breaks, we see the world not as it is, but as the brain imagines it. Thank you for watching The Psychonurse. If this video expanded your understanding of the mind, subscribe for more psychological deep dives. Until next time, take care of your brain, because it's the only reality you truly have.